Here's the skeleton, kind of zoomed out. The cervical spine is obviously referring to the neck. So we're going to zoom in, and we're going to look at what we would call a typical cervical spine first. So I'm just going to pick C3, so that would be your third cervical vertebrae, and we're going to isolate that because it's easiest to learn about the anatomy if we just take it and we do what we would call your typical vertebrae. So this is your typical vertebrae in the cervical spine. As you can see, this would be the anterior side. So this would be called your vertebral body. So that's going to be your vertebral body on the anterior side. That holds the weight of the vertebrae above it, and it would be, since we're in the cervical spine, it would be the head as well. Then if you look just lateral to the body, we have these holes. Holes in the human body are almost always called foramen or foramina. This is called the vertebral foramen because it holds the vertebral artery as it makes its way from the heart up to the brain. Here, laterally, we have what we would call the transverse processes. The transverse processes are on the lateral side, hence the term transverse. Now, as we make our way posterior, we have a canal, the spinal canal. This is where the spinal cord would run if the spinal cord was pictured here. Now, let's turn this bad boy and look from the side. So this would be a lateral view as if you were looking at somebody from the side of them. And I want to point you to a couple of structures, namely the facet joints. So this would be called your superior facet joint right there, and this would be called your inferior facet joint right there. And these facet joints articulate or touch the facet joints on the vertebrae that would be above or below it. One thing I want you to little note here, and we'll go over this a little bit more when we talk about mechanics, is there's a 45-degree angle right here, and this 45-degree angle is going to be important when we talk about how much motion our cervical spine has. So remember that 45 number.